Welcome to the second edition of the Cannabis Science Digest, sponsored by CVResearch and makers of Plus CBD, where we break down 3 great science articles from this week. Today we have neuropathic pain from spinal cord injuries, cognitive decline from cancer treatments, as well as the UK Medical Cannabis Registry and ADHD. Neuropathic pain or nerve pain is very hard to treat. It's often untouched by the typical drugs that are given, and in spinal cord injury patients, about 60% of them have neuropathic pain. This was a survey with 227 spinal cord injury patients who were experiencing neuropathic pain. Of those, 87% reported that cannabis reduced their neuropathic pain intensity by more than 30%, and over 90% reported that cannabis helped them to better deal with the neuropathic pain symptoms. Also, 80% reported that they substituted their pain medications for cannabis, with the most common substitutions being for opioids, gabapentinoids, and over-the-counter pain medications. Surprisingly, most of these patients were only using cannabis once or twice a day, and only at the amounts of 2 to 4 grams per week. In addition, patients reported that cannabinoids helped to decrease their stress, anxiety, and depression, their spasticity, their insomnia, their feelings of nausea and vomiting, while increasing their relaxation as well as appetite and focus and concentration. The negatives included the usuals: dry mouth, drowsiness, and cough. In addition, a quarter of them reported no negative side effects from cannabis and the cannabinoids. In addition, most of them reported using THC, and about half were also using CBD. Reserve gummies with 5 milligrams of THC and 25 milligrams of CBD. For more of the many cannabinoid studies on pain and inflammation, go to CVResearch.info for the archive I maintain there. Link in bio. Next, here's a cancer study. And if you didn't know, many of the treatments for cancer cause cognitive decline. In this study, they enrolled 8 patients and gave them a battery of neurocognitive tests. Then for 2 weeks, gave them 12.5 milligrams of dronabinol, which is a synthetic THC. Then they gave them the same test, and they found that they scored significantly better on those neurocognitive tests. However, one problem with this is dronabinol is often likened by patients to a kick by a horse. It is simply THC with nothing else in it, and it can either be way too strong for people or it just doesn't work at all. This is why full-spectrum products tend to win versus isolates, because that array of minor cannabinoids and terpenes help the THC to work better, but also they have their own positive benefits as well. As Dr. Raphael Mechoulam, the father of endocannabinoid system, said, he wishes that all cannabis, whether medical or recreational, had at least 1% of CBD in it to help modulate the effects of that THC. For more on the neuroprotective effects of the cannabinoids, see this page on CVResearch.info. Lastly, something I love, the UK Medical Cannabis Registry, where they just keep the information about the patients in the UK using cannabis, and every couple of weeks a new study comes out, parsing that information and learning from it about what works for people. In this study, they followed patients for 12 months, and they found an associated improvement in self-reported anxiety, sleep quality, and health-related quality of life. The most common things people are using cannabinoid-based medicines for were chronic pain, neuropathic pain, fibromyalgia, and anxiety. Then on that same day, they released a follow-up on ADHD. Out of the 68 patients they looked for, they found cannabis treatments for ADHD caused improvements in anxiety, sleep quality, and general quality of life. Of the 13 patients taking other medications, 5 of them stopped taking their methylphenidate, dexamphetamine, or lisdexamphetamine. That's it for the Cannabis Science Digest. See you next week. Insert shiny flashy logo.